So today I'm going to talk about a type of treatment that we read about every day in the newspapers and the magazines, and that is lasers. I'm going to briefly address what lasers are particularly useful for doing, and why lasers may have some specific advantages over other treatments that dermatologists might offer over and above those different treatments. Okay, so how do laser treatments work that you might receive? Well, first of all, what is laser? Well, laser is actually an acronym. It stands for light amplification by stimulated emission of radiation. Well, we're all a lot wiser now, aren't we? What does that mean? What it means is lasers are actually a part of visible light, but instead of being all the wavelengths of light, all the different colours, it's just an individual wavelength that is amplified to an incredibly high power, which gives us the potential for a very, very, very focused, controlled single wavelength of light, which means that we can target it very precisely. We tend to use lasers in two scenarios in dermatology. One is to help recolour some aspect of the skin, and one is to help resurface the skin texture in some way. Because with light, there's an interaction with the skin, an attraction of opposites. So if you've got something that's a red colour in your skin, and you shine a yellow light at it, all the energy of the laser light is actually absorbed. So you can make your treatment very specific for the red change in the skin by using a pure yellow light laser. For instance, if you're treating broken blood vessels in aging skin, or if you're treating a birthmark in kids. Likewise, if you want to target something brown in the skin, you might use a green wavelength of light, which will be specifically absorbed just by the brown pigment, but not by the skin that's next to it. So lasers can be made to be highly targeted for things that we treat. We can also adjust the length of time that the laser energy is on, and we can deliver the laser energy not just in seconds or parts of seconds, but millionths of seconds, incredibly short bursts of energy. So the laser offers the advantage over most other treatment modalities in that we can target specific changes in the skin in a very targeted way, not damaging the surrounding skin. That means the risks of scarring as a result of the laser treatment can often be less than other alternative treatments that as dermatologists we might choose to deliver. So lasers for recoloring of the skin is a big area in which your dermatologist may choose to switch on a laser. Now, the other area in which we use lasers a lot is in resurfacing the skin, retexturizing the skin, if you like. And when we think of using lasers in that scenario, there's two main branches of possibility. One is where we blow the skin off. We actually vaporize the skin completely. It converts to steam, evaporates, takes the skin with it. And this is called an ablative treatment. Ablation meaning this vaporization and blowing off of the skin. The other type of treatment is called non-ablative, where we're trying to change the texture of the skin, but achieve clinical results without vaporizing the skin completely. Now, there's a linkage between how aggressive and how ablative your treatment is. There's a linkage between the cosmetic result that you get and the risks of the procedure. If you have what we call full surface ablative treatment, where we remove an entire component of your skin, the chances of when the skin heals back producing a significant change in the skin, where you might see photographs of dramatic improvements in wrinkles, for instance, or folds of the skin, or individual texture changes, these greatest changes, these photographs that take your breath away and you think, I want that treatment. The problem is the treatment, the ablative treatment that goes deeper, has got a much higher risk of side effects. Two main side effect risks. One of pure scarring, where the skin essentially responds as if it's been burnt and you can get scarring. The other main complication is that when the skin grows back, the skin that grows back may not be scarred, but it might not have the same amount of pigment in the skin as the skin that's been vaporized, leading what dermatologists call hypopigmentation. In other words, paleness of the skin. And if you have such an aggressive treatment, say around the mouth, if you've got barcode lines here, you can end up with the area around your mouth being much paler than the rest of the skin. Likewise, if the same's done around the eye, you can end up with paleness around the mouth, paleness around the eyes, and for the rest of your life, you look a bit like a raccoon. And this is not a great look. Some patients have to, before they get out of bed in the morning, put makeup on before they can face other people. So the greater the benefit, the greater the risks, and you can't break that link. And that's why, because of the risk profile, non-ablative treatments have become very popular. Now, for sure, these treatments are much safer, but unfortunately, they don't produce the same dramatic results, certainly not with a single treatment. So with a non-ablative laser treatment that's not as risky, you're probably going to want to do 3 or 4 treatments over a period of a year or 18 months, and your actual improvement will not be as great as with a fully ablative laser. But because of the better risk profile, non-ablative lasers are increasingly used and can be very helpful as an adjunct to an active skincare treatment. But because lasers are potentially so powerful, and they're always appearing in superhero movies and things, cutting limbs off and stuff, because they are potentially very powerful, it's very important that you feel comfortable in the competence and training level of whoever your healthcare practitioner is. So training is very important when it comes to selecting lasers, particularly for a resurfacing procedure. Finally, there are other non-laser potential treatments for resurfacing of the skin. Chemical peeling is another alternative way to go about getting useful clinical treatment outcomes. But again, with chemical peelings, the gentler, the safer, the more superficial the peel is, the less impressive will be your clinical results. But the deeper, more aggressive peels carry the same risks of increased scarring and increased colour changes. But this ability to fine-tune, control and make the laser beam highly specific means that it's a hugely attractive tool to have, particularly in the hands of procedural dermatologists or plastic surgeons who find the laser a very, very useful tool to use. So I hope you found that useful. I hope that it's addressed some of the questions that you might have. If you liked it, press like, follow, and send in questions that you would have liked me to have addressed regarding lasers, and I'll get round to responding them in the future. Thanks very much.